So how does posture affect your back, and how does it cause or contribute to back pain? So if we consider ideal posture, you should have a nice S-shaped curve in your spine, with each angle of the curve in the upper back and the lower back being around 30 to 35 degrees. As I was saying in my previous video, your head should be centered over your center of gravity. Your rib angle should be about 25 degrees, and your pelvic inclination in men is about 8 to 10 degrees, and women around 10 to 12 degrees. Now, what happens in poor posture is the head comes forward of where it should be, and for every inch the head goes forward, it doubles the load on your neck muscles. It leads to a straight neck or a straight cervical spine, which puts undue stress on the ligaments and joints in your neck, and particularly at what's called the junction between your neck and your upper back, and it leads to that sort of bump in the upper part of your back, or a dowager's hump, it's sometimes referred to. That changes the inclination of your first rib, making it steeper than 25 degrees. Now that is going to completely change your breathing mechanics and cause you to use your accessory respiratory muscles, your neck muscles, which can cause neck pain, trigger point development, jaw pain, tension, headaches. What we typically see in office workers is you have a much greater curve in your upper back. It's typically 45 degrees or more. That puts more strain on the joints and the ligaments in your upper back. Your shoulders tend to migrate forward, and this can cause shoulder impingement. Now we go back down into the lower back, and you typically have a much flatter lower back. If you're sat down in a chair all day, your pelvis is tilted back and your low back flattens out and is no longer a 30 to 35 degree curve. It's not uncommon for that to be as low as 10 degrees. Now that puts the discs at risk in your low back, and also the ligaments and the joints. And if you're sat down all day, your pelvis tilts backward. You have a much flatter pelvic inclination, and it causes extremely tight hamstrings, which can predispose you to hamstring injury, but will also exacerbate low back pain.